Okay, guys, we're just waiting for everyone to join and then we'll start straight away. Thank you very much. Please, guys, I believe right now I may be on Facebook Live. So if I'm Facebook Live, please, guys, let me know. Thank you. Today, actually, it's a very important topic because dental care is a topic which is not just only included in preventive dentistry or operative dentistry, but actually it's included into lots of other subjects. So that's why it's very important. And by the way, pediatric as well, like even I forgot to say this in the post, even pediatric. It's involved in pediatric, involved in oral surgery, endo, perio. That's why it's very important subject for you to pass the exam. And I would say that one of the things can make you pass the exam if you really focus on it very well. Okay, guys, please, guys, if you can see that you are online on live on Zoom on Facebook, please, guys, let me know. Let me check. Okay. To a new window. Sorry, guys, because sometimes I need to do things here for my site. Just okay. Okay, guys, I checked right now and seems like I am on Facebook Live right now. Let me just get the let me just get in here. Back again. Just home. Here. Just go down. The page itself. Okay. Yes, I believe now things settle down and I can see the comments and I can see you guys here. Okay, so let's start. Before guys start, I would love to check in everyone of you. And then I can, guys, how you doing? How's your preparation? I know this week it's a week of prosthodontics. So we went through removal partial denture, and then these days we are in complete denture, and then next days will be in fixed partial denture and implant. But today is the second session of Icdas, which is the most important part out of it, which is management and treatment. So guys, there is a big difference between management and treatment. Do you know, guys, what's the difference? Before I even ask this question, I see you guys, Dr. Shiranka. Hi, Dr. Shiranka, how are you going? Dr. Dimple, how are you going? Dr. Taslim, how are you going? Dr. Muhammad, how are you going? Dr. Saka, Dr. Shiva, Dr. Sangeeta, Dr. Shashank. Thank you, Dr. Shashank. To let me know, Dr. Daniel, Dr. Fatima, Dr. Natalie, Dr. Hussein. How are you going, Dr. Hussein? Thanks very much. Dr. Yatri, Dr. Sanpreet, Dr. Maria, and Dr. Amolia, and Dr. Gagantib, Dr. Monisha, and Dr. Maria, and also Dr. Kalaljit. Okay, guys. So as I mentioned right now, there's a big difference between management and treatment. Guys, I'm not quite sure, guys, if you know the difference between both or not, but guys, am I audible to everyone? Let me check. Okay. Hi, Dr. Ron, how are you going? So guys, difference between management is anything you do in the dental clinic, anything you do it from the beginning when you say hi to the patient until you see the patient after 10 years for the same concern, it's called management. So management is very broad word, but treatment is normally things you do it physically by your hand. When you give advice to the patient, that most properly it's a part of management. But when you start to do restoration by your hand, which is a physical action, we call it treatment. So guys, the difference between management and the treatment is not the same. Okay, so as I mentioned before, hi Dr. Leo, how are you going? So guys, as I mentioned before, today going to be about the ICDAS, which is ICMM, ICSM-S, which is the same thing. And then mostly in the management and the treatment part, as you see here. We will use today evidence-based and clinical approach, and mostly for ADC exam. However, it still can help you in your practice if you work in your practice. Okay. I found actually lately that people they're trying to memorize things from TG and from ICDAS guidelines itself, and seems like creates hard to memorize things, and that's why I have followed completely different approach to understand ICDAS the way that it can help you to pass the exam. Let's now go through this approach. Guys, do you see my PowerPoint, by the way? Sometimes. Hi, Dr. Surisha, how are you going? Hi, Dr. Naveen. Yes? Okay, that's great then. Now, that's, guys, apart from ICDAS we discussed last time, if you remember. We mentioned that there is 4 Ds. Last time we discussed about the first D, which is determine, which is more into assessment. And the second D, which is again assessment. Today we're going to do the third and the fourth Ds, which is decide on
a personalized care plan, and to do appropriate prevention and preservation intervention, which is decide on a personalized care plan and do appropriate prevention and preservation interventions. By the way, going through these the way as it is a little bit complicated. So again, as I said, I have changed the way being presented in Icdas in completely different way to make it easy for you to understand it. Now, let's start with primary teeth. Okay, in primary teeth. Guys, looking at this caries here, can you tell me first which code it is? Last time we discussed the coding. Last time we discussed the risks, if you remember this. And then we said there is 0 to 6 code, and then everyone, it does mean something. So what do you think the code of this condition? Let me check your Facebook. The answer is A alpha. I see guys, most of you mentioned A alpha. Code 102. Very good. Easy now, right? So in the exam, you're going to get a similar question like this. And then they ask you, what is the code sometimes? Especially now, Icdas is a part of TG, right? In new TG. So they may ask directly about the Icdas. Or they may just provide the photo and with some risk factors, and then they ask you what is the management of this part. So if your answer is A, you're totally right, which is A alpha, code 102, that's correct. Guys, if you really know how we ended up with this, I have done previous sessions before about this topic, and I believe it's in our private recordings in our applications, and also it's a public on Facebook and YouTube. Okay, so your answer right now, it's code 102, which is totally right. Let's see now. So the answer now, as you see, it is A alpha code 102 carries. So the second question is, which is clinical case 1, based on ICCMS, which is ICDAS criteria, and your diagnosis of elevated caries risk. You have diagnosis patient with elevated caries risk. What is the best management then? Is it A, apply fluoride vanish every 3 months? Or recommend 1000 ppm fluoride to space twice daily? Or C, which is apply fluoride gel every 6 months? Which one of these? Let me check your Facebook, your answer on the Facebook. I see the answer now is B, Bravo, which is recommend 1000 ppm fluoride to space twice daily. And then I see different answers, which is A alpha. That's apply fluoride vanish every 3 months. So now the confusion between A and B. Dr. Daniel Hani said A alpha, fluoride vanish. Dr. Gilan Ibrahim is A alpha. Okay. And then we have Dr. Norman B. Bravo and Dr. Gagan B. Bravo. And most of you guys be between B and A. Now, make it easy for you. Guys, who's happy with B Bravo and who's happy with A alpha? Because think about it, right? Patient has elevated high risk, as we mentioned here right now. It means Dr. Leo, you always be. You are the queen of B. So I know this, Dr. Leo. Think about this way. The best way, guys, to get the answer to these questions, not just to memorize what you have read in the books. Because if you just only memorize what you read in the books, you can be right, as books be right. But the problem is, books giving you the all options. And then there is always keyword in this option that may change your decision to decide in your management in the clinic. Saying this, the books definitely has mentioned to us that it's very important, which is Icdas itself, the topic we discuss right now, that the patient should brush the teeth with 1000 ppm fluoride. Also, the books mentioned about a alpha too. This is correct. This is correct. And even use fluoride mouth rinse, it can be correct, but the patient age is very young for it. So A and B can be correct, right? Which one is more important? Think about it clinically. You don't need to memorize anything. Let's say if you have a child and this child has caries like this, you have only two options. Only two options. One of them, you only allow to do only one of these two options. Only one. Tell me which one more important to reduce caries. Think about it clinically. To ask the child to brush his teeth every day, twice, with a high fluoride toothpaste every day. That's one option. And then think about it. You don't need, think about this way. And then there is no dentist around the area to get the fluoride vanish. That's the first option. Tell me which one you ensure that teeth are more cleaner and then that is more stronger. Or the second option is the child doesn't brush the teeth at all for 3 months time and he goes every 3 months to see a dentist. So in this case, which one is more important? Is to get the child to brush his teeth twice daily without seeing a dentist for vanish, or to stop completely brushing the teeth with 1000 ppm fluoride and then see the dentist only every 3 months. Which one? Be now, Dr. Fatima, did you get it? Otherwise, his mouth will be rotten. Imagine someone doesn't brush the teeth for more than, right, for more than 3 months, how it gonna be? Thank you, guys. I see now you understood the concept. By the way, if you check TG has mentioned it directly. That's brushing the teeth as the most important measure of hygiene. Okay. So now, guys, I'm happy. Everyone, you got it. Right? Yes. The child, again, there is maybe, anyway, we're going to discuss about toothpaste right now. That is great. Let's now go back again to this slide. So the answer is B, bravo, which is recommend 1000 ppm fluoride toothpaste twice daily. Now, clinical judgment. Let's now do the clinical judgment. Now, what we call it as Bidu math. I made Bidu math here, guys. Just write it down in your Bidu math book, because we mentioned before you need to do different books. One of them for the concepts, daily concepts, and other notes for Bidu math. Now, diagnosis was code 1 or code 2, which is mean initial caries. So we understand with initial caries, the treatment should be mineralization. Guys, do you agree on this? That's why we're choosing 1000 ppm fluoride toothpaste twice daily. Why? Because we aiming for remineralization. Great. So now we're talking about remineralization. So the first management you need to understand about the new Icdas is remineralization. When should you do remineralization? We do remineralization in code 1 and code 2. Code 1 and code 2, we call it initial caries or initial decay. Let's discuss more about remineralization or mineralization. Now, in remineralization, or you call it mineralization, we need two steps. By the way, guys, this is your Icdas, but in completely different way, different technique. You will not again find it in Icdas itself. You will find it if you take it like pieces, small pieces, but I'm trying to explain the way that's make it easy for you. So now, to mineralize that patient, let's say to mineralize, we call this patient Sarah. To remineralize Sarah's teeth, we need to do two things. In Icdas, they call it as home care, and then professional approach, which is dental clinic. As you see right now, the tooth looks like stronger, right? So we make the tooth stronger. That's called remineralization. So we're gonna make this white lesion strong. How we can do this? Let's start with home care. Home care, we're going to do two things mainly. Oral hygiene, right? And then the second is fluoride applications at home. I will advise this patient, right? This little girl, to do two things at home. One, to enhance hygiene. Two, to apply fluoride. Let's talk about oral hygiene first. What things this patient need to do? Definitely to brush the teeth, either twice a day or more frequently based on the toothpaste they use. The second is to flossing. The third is modification for all risk factors. Guys, be careful from this word, modification, because ADC love to use this word modification. So now, what sort of modification? Maybe diet. We need to reduce diet. We need to reduce carbohydrates in diets. It could be saliva. It could be medical issues. So any risk factors involved in this should be modified. Okay, great. Now, what about fluoride? You see now what has happened. Toothpaste should shake the hand together with mouth rinse, right? So fluoride application can be different ways. You can get fluoride application as a toothpaste. Guys, by the way, that's all you need to know. There is no more than this. I know in TG, it has given you all the options together, and then you need to memorize everything, but now you don't need to memorize everything. Just only memorize what I'm talking about. So now, I mean, just only, you don't need to even memorize what I'm talking about right now, but I need you to listen to it properly and write it down now. Now, at home, you need to think about fluoride applications in different forms, mainly toothpaste, mouth rinse, and then maybe too smooth. These are the three main, or actually there is no any more than this at home the child can use. There is water, but water, it's not in the patient's hand. Water comes from the tap water. Now, let's talk about the toothpaste. Depends on the patient age. By the way, I stopped here until 6-year-old to make things easy for you. So a patient which is less than 18 months, no toothpaste. That's it. No toothpaste, no fluoride. When the patient has low risk or no risk. What about 18 months, but is at risk, high risk? In this case, it's recommended to use fluoride. Sorry, toothpaste, and then twice a day. What if the child less than 6-year-old, like between 18 months to 6-year-old, and the child not at risk? In this case, use a child toothpaste, the 500 or 550 ppm, twice daily. What if the child is at risk? In this case, the child can use 1000 ppm or 500 to 550 more frequent. I hope it's clear right now. So Sarah, how old is she? I think she is about the age, which is less than 6 year old, maybe 5 year old. That's why we're choosing 1000 ppm fluoride toothpaste. What if Sarah doesn't like the other toothpaste, which is 1000 ppm? In this case, we can ask her to keep the child toothpaste, but she should use it with more frequent. Now we done with toothpaste. What is the other form? We said mouth rinses. Okay. Do you think a child who is younger than 6 year old can use mouth rinses with fluoride? The answer is, let me check your answer. Can a child less than 6 year old, I make it easy for you, that's a pedo math. A child less than 6 year old, no, easy. No fluoride mouth rinse for them. Okay? Let's get this one to you right now. Let me check this. Okay. So now, only you can use fluoride rinses when the patient is older than 6 year old, like 6 or older, about this age. Now, we have two types of mouth rinses. And actually, let's say one type of the mouth rinses, but they have in different concentration. We have the neutral fluoride rinse, which is 200 ppm, and the same fluoride rinse, but with 900 ppm. The neutral fluoride rinse, we use it once a day, while the neutral fluoride rinse 900 ppm, which is high concentration, we use it once a week. Guys, please, guys, be careful on this because, again, this is easy. A question in exam. When do we use the 200? Guys, can you give an example of each? I only need one example of each because once you give me the example of each, you will understand when we need to use both because it's not haphazard, it's not randomly. Do you think it's randomly? I will prescribe 200 ppm or 900 ppm. It's not randomly. I cannot use both of them in the same time or exchangeably. I must have the indication for 200 ppm and my indication for 900 ppm. Let's start first. Give me an example of either 200 or 900. Let me check your answer, see if you really study or not. Oh, seems like no one of you study, guys. That's not good news. My champions don't study? Both of them, we use them in high risk. I need clinical example, guys. The one gonna mention the clinical example, I will be very happy. Both of them, they've been used in high risk, guys. Both of them. I mean, there should be a risk. I don't need to use fluoride on daily basis. Only I use it when there is a condition. Tell me what is the condition then. I'm just waiting for the lovely champions. Okay, guys. I will tell you right now. No, there is no mouth rinse. There is no mouth rinse is recommended. For a child 18 months, no, there is no mouth rinse. It cannot be. Okay, no, not rampant caries, no. Okay, guys, write down this, please. Okay, at least Dr. Kelvender said something. Okay, guys, everyone likes Dr. Kelvenda comments because she is very close to the right answer. The only one has mentioned something now clinically right is Dr. Kelvenda. I give you heart, Dr. Kelvenda, then. Guys, all of you is just only running behind when there is a risk, high risk, high risk. In exam, by the way, this is the problem. That's why you choose the wrong answer in exam if anyone going to do it. Think clinically. Why should I use mouth rinse? Right? Because I cannot brush the teeth. Easy. Guys, did you get the answer right now in your head? Why I cannot, why should I use mouth rinse, fluoride mouth rinse? Because I cannot brush. Easy now, guys? Bido math. Cannot brush, use mouth rinse. Easy? No, guys. Whatever answer I mentioned right now doesn't make sense for me. Sorry, guys. I'm very honest to you. Where is Dr. Calvenda? Big heart for you. Again, guys, easy now, guys, about this? Thank you very much, Dr. Everyone now love Dr. Pawandib answer now. That's the one I'm looking for. Exactly, that's the one. Please, Dr. Pawandib, just I would love you to explain this to everyone. Look, guys, what she said. That's true. And this is the exam about. Exam is not about, you have read TG. What after this? Not enough. You need to think clinically. Dr. Pawandib mentioned something very important here. Let me just share the screen, guys. So things will be clear to every one of you. Zoom, share. Okay? Yes. What she mentioned is right now, in case of hepatic gingival stomatitis, true. If the patient or the child cannot brush the teeth, in this case, we need still to protect the teeth. How to protect the teeth? Ask the patient to use mouth rinse. Thank you very much, Dr. Pawandi, for this. And also, I think that was Dr. Calvenda. Thanks, guys, very much for this clinically based, perfect information to help everyone here. Patient doesn't want to use toothpaste. Maybe Dr. Amolia, but that's going to be really in high risk because we need to convince them to use toothpaste. Okay, that is great then. Patient preference and cooperation, and if patient doesn't like toothpaste, maybe Dr. Victoria. That's true as well, but we have more serious situations than this. Okay, guys, now, do you think mouth rinses can substitute toothpaste forever? Do you think that mouth rinses can substitute toothpaste forever? The answer is no. It can be temporary under some circumstances. The way has been mentioned right now by Dr. Kelvender and Dr. Pawandib, right? When the patient cannot brush the teeth in some circumstances. In patient with necrotizing gingivitis, the gums very, very, very irritated and very sore, the way that if the patient just gonna touch it with a toothbrush is going to scream. That's why we need to help the patient to keep the teeth clean by prescribing mouth rinse with fluoride at the time that the gums are irritated. Then after this, they can shift back again to toothpaste. I hope now, guys, the idea is clear to everyone. Perfect. So now, if you get this question exam again, they ask about toothpaste or mouth rinse, you understand when you should use each and which one is more important than the other, and with concentration as well. Perfect. Now let's go back again to the slides. Sorry guys, I sometimes take time, sometimes it take a little bit of time to keep jumping from the slides to Facebook. Now, what is the third option? The third option is to use fluoride, CPP-ACB cream. And this cream, actually, it can be used in all ages. Look, I have my own, and guys, you can check this in your own, okay? I am very skeptical in this part because I believe, look, in TG it has been mentioned, right? It can be used in all ages. But the people for CPP-ACB themselves, which is too small people, if you're going to check their own website, and this is other manufacturer, these are the people really they made this product, they mentioned that if you add fluoride to CPP-ACP, which is, as you see, 900 ppm, which is really high, like here, it's just a logic. If the mouth rinse, which is 900 ppm, you not allow it to anyone to use it until 6-year-old, so it should apply the same concept when you use CPP-ACP with fluoride. Am I guys making sense right now? Does it make sense to you? But if you're going to check TG in this part, which I hope that they really do some changes in it, or maybe, I don't know why this, right guys? So in this case, it shouldn't be actually this way. It shouldn't be all the ages. Guys, do you agree in TG has been mentioned it can be used at any age? They didn't give any restriction in this product in TG. But if you go into check in your own, or on CPP-ACP too smooth itself, they mentioned there is a restriction age once you add fluoride it is. Can you say this again? Okay, I'll repeat again. Guys, did you read TG before in this part? In the part for fluoride plus CPP-ACB cream? In TG, what's mentioned? There is any age restriction there? CPP-ACB cream itself, it has no any restriction, by the way. But once you add fluoride, NTG has mentioned that there is no restriction, all ages. I'm very happy Dr. Natalie mentioned, yes, in all ages. Yes, Dr. Lev in TG, right? Very good. Does it really make sense for you? Why in neutral fluoride rinse, which is 900 ppm equal to the same concentration in CPP-ACB, why there is restriction and should be only used in 6 years? However, in too smooth, we ask the patient to swallow. Yes, it does mention for adults and children, right? To swallow, even. So in this case, if you go into check CPP-ACB cream from the website itself, you will find they put restriction the age, and they ask you only to use it while maybe about 6-year-old and maybe 2-year-old. I'm not quite sure, but normally I be in safe side and make it after once any fluoride, I do it after 6-year-old. Okay. Guys, exactly so far, guys, because once we have CPP-ACP without fluoride for this child, that's okay. They can use at any age, any CPP, like until this, let me just get this to make it clear for you. So what I'm trying to say is this part only at any age. But once you add fluoride for 900 ppm, TG mentioned it can be all the ages, but CPP ACP cream company itself for Too Smooth, they mentioned should be restriction. Okay, now guys, it's your choice. If you get similar things in exam, it's your choice. But clinically, what I do is I don't prescribe fluoride, any fluoride type, under 6-year-old because I'm worried that the patient will swallow it and then end up with toxicity. Both of them, they have risks. Both of them, Dr. Legis. I agree in this, but both of them, they have risks. Especially in Too Smooth, we ask the patient to swallow it. In mouth rinse, we ask the patient to spit it and should be under supervision as well. Anyway, I hope now guys can. So let's revise this again. At home, when there is a high risk for a child, we will not be able to use. We only need to use 2 things mainly, or 3 things, I would say. 1 is toothpaste. 2, mouth rinses if toothpaste is not available for any reason. 3, Too Smooth with fluoride or without fluoride. But if it's with fluoride, please be careful that the patient should swallow the fluoride. Dr. Bido, the chart before said fluoride is recommended for 18 months at risk. Which chart is, doctor? Okay. Back again. So now we finished at home. Let's now think about what things of management or fluoride at the clinics. Definitely check up and clean and stuff. That is okay for clean. That's normal. What about professional applications of fluoride? We have these forms only. These forms. The first form is fluoride varnish. The second is gel foam, which is again gel foam. This is acidulated. It has acids in it. And this is neutral. And then silver diamine fluoride. And then CPP ACB, you can apply it by yourself, plus fluoride varnish, which is very high concentration of varnish, which is 2%, which is very high. Now, when should you apply fluoride varnish? Any age. That's okay, as long as there is teeth in the mouth, which is older than 1 year, because normally we expect the teeth can come out at 1 year old, right? So now we need to use fluoride varnish normally at 1 to 2 years. Sorry, once or twice every, can be even more than this if the patient has higher caries risk. And then foam. Which one of these is more recommended? Is it varnish more recommended in dental clinic, or gel, or foam? We recommend, and if you get question exam about this part, and then they ask about dental clinic, not at home, because at home the best is toothpaste with fluoride, depends on the risk and the patient age. But in the clinic, we recommend varnish. Why? Varnish does stuck into the teeth. Stuck. It's oral base. Stuck into the teeth. Right? Like a glow into the teeth. And that's why it's very safe. The child will not swallow it. Also, it does stay for a longer time because because it's stuck into the teeth. Also, it has very high concentration of fluoride. That's why we prefer fluoride vanish. What about the gel and foam? Do you really prefer gel and foam? Yes, but after vanish first. When do we use acidulated? We use acidulated. It has been proven somehow that acidulated can be used in cases of high risk, but the patient has good saliva contents in the mouth. Why? They mentioned when it's acidulated, it can penetrate faster into the teeth. Neutral. When we use neutral, we like to use neutral in the cases when the patient under radiation therapy or the patient has low saliva. That's why we like neutral in cases more than acidulated. Silver diamine fluoride, which is Rivastar. By the way, Rivastar, guys, or silver fluoride has been prohibited in Australia for a long time, for more than 20 years or 25 years. And the first time I saw it in the market, I was very happy. That was 2015, 16. They came back again onto the market. We don't recommend it in the first instance. It's not our gold standard, but it can be used in different circumstances, different situations. It's a temporary solution. Just keeping this in your mind. Silver fluoride is a temporary solution, mostly. Why? Because it's darken the teeth, make the teeth black. For sometimes, when you are worried to remove the caries for any reason, if you are worried or you cannot remove the caries for any reason, what you need to do is just try to remove the loose, soft tissues or particles inside the cavity. Then get a piece of silver diamond fluoride because it's a filling, by the way, filling, and then just put it on the tooth until sometimes. Then you can remove it and then put your permanent restoration. There are lots of cases, a child which is uncooperative, a child that he has lots of caries and they have no time and they need to do something quickly. An old guy, old man who cannot brush the teeth, he cannot stay for long time on the dental chair, you need to do something quick for him, just do this for 6 months or 1 year. I hope now, guys, the indication of each condition be clear to you. One second. I'm not quite sure, guys, if you can see my slides or not. Let me double check this because I think I am. Guys, can you see my slides? Things are clear, right, guys, for everyone? Yes, guys, can you see my slide? Yeah, it is, but it's good. I really like it. I really like it. Personally, I like it, but it used just only temporary, guys. Okay. Dr. Daniel mentioned clear, but we repeat. Okay, I will repeat. So now, guys, I will ask you, and then just you please answer me. Out of this version in your practice, which one is the most recommended? Out of this version, all of this fluoride products, which one is the most recommended? Vanish. Why? Very good, Dr. Natalie. Why Vanish? Thank you, Dr. Dipel and Dr. Kelvenda. Why Vanish? Because one, it has high fluoride concentration in it. Two, because it's very safe. Why it's safe? because it does stuck into the two surfaces. So in this case, it can use the at 1 year old. No problem to use it. 3, it is very effective because it does stay on the two surfaces for a long time. So fluoride vanishes the best. What is the second best, guys, out of this? I would say neutral. The most, okay, what is the most effective? After this, I would say, in this case, the last option, which is fluoride plus CPP-ACP, vanish. It is really very effective because in this case, you give calcium, phosphate, which is in CPP-ACP, plus varnish. That is the best, second best, I would say, right? If you consider the first option, let me just do this for you right now. I need to ensure I am actually sharing the right thing. Yes, I'm sharing the right thing, okay? So now, in order, vanish is the best or vanish with CPP-ACP. However, vanish with CPP-ACP will be even much better. So this is, let's say, number 1. That's number 2. This is number 3 as the most effective. Why? Because it is acidic. When you have acidic fluoride, it easily can penetrate into the tooth structure and then remineralize it. And then neutral fluoride. But neutral fluoride gonna be the fourth because it's used normally when you have high saliva contents. Fluoride, silver fluoride, diamine, silver fluoride filling. It's good to be used, but in circumstances when you cannot do the proper filling. And by the way, it's used temporary. I hope it's clear right now, guys. The different version of all modalities in the clinic. Why this one doesn't remove? Okay, all drawings, yeah, now it's cleared. Okay. Now, what do you think, guys, the answer of this? We finished remineralization. Now we're going to talk about different treatment, different management. She's 5-year-old. And then we're talking about tooth number 6-2. What do you think is the management? Is it A or B? The question asked about tooth number 6-2, this tooth. I make it easy for you guys. We're talking about this tooth. It is B, bravo, guys. It is B, bravo, because I see cavitation happened here. Look at this cavitation. I see you have different answer between A or B. It is B, bravo. There is a cavity. Guys, do you see this cavity or not? It's here. Look at here. Look at this. Guys, can you see this cavity? Please, guys, be careful in the exam because believe me, these are the things that happen in your exam. You don't pay attention to the X-ray. You don't pay attention to the photograph. Okay? There is cavity here, guys. Now, if there is cavity, which code it gonna be? Is it code 1 or 2? Or code 3 or 4? Or 5 and 6? Or hypomineralization or fluorosis? Yeah, 6-2 is lateral incisor, yes. Because this is 6-1. Because this is 6-1. This is 5-1, 6-1. This is 6-2, okay? Code 3, right? Very good. Yes, doctor. Yes, Dr. Amol. Yeah, it is. It is lateral incisor, okay? Yep. So it's code 3 and 4. If now we have code 3 and 4, look at it right now. Let's look at it together. Okay. Now, guys, what is the answer? 3 and 4. Sorry, guys, I was actually drawing on the Facebook. Sorry. Now, this guy's 5-1. This is 6-1. This is 6-2. This is cavitated here. Sorry, guys, I was drawing, but I was drawing in my screen, the Facebook, so you couldn't see it. Okay? This is cavitated. Okay? I hope it's clear right now. What is the treatment then? Are you going to do remineralization? Let me just check this one again. Remove. Now, what is the management here? Are you going to apply fluoride vanish or 1000 ppm fluoride toothpaste or restore with composite or prescribe 5000 ppm or restore with resin modified GIC? Which one of these guys will be the best management for tooth number 6-2? Let me check your answer. Thank you very much. Cavitation means filling. Thank you very much, Dr. Daniel. Restoration. I'm very happy. Restore. But which one the right answer? Are you going to restore with composite or resin modified GIC? Dr. Natalie mentioned C. Charlie. Dr. Dimple said E. Echo. Dr. Asanka said C. Charlie, E. Echo. Now I see you guys going with different answers between E and C. Make it easy for you. It has been proven right now that for baby teeth, resin, or actually GIC, glass ionomer, is the gold standard right now for baby teeth. Make it Bido bites. Let's go back here again. So the answer is E echo. Restore with resin modified GIC. Why? Clinical judgment. Bido math again. Because it is code 3 and code 4, and we understand that, guys, this is your Icdas, by the way, but different approach, okay? The approach I'm using today is clinical judgment approach. Now, we understand code 3 and code 4 means the enamel has been broken down and damaged. What does it mean? Means there is cavitation, as you see here right now. And because there's cavitation, what we need to do is it's a moderate size. Because it's moderate size, restoration will be enough. So now, if there is cavitation and the cavity in moderate size, in this case, you restore. Because the next slides, the next cases or the next clinical case, I will provide you with different scenario. So now, 1, cavitation plus moderate size equal to restoration. Baby tooth, we prefer GIC, then composite. Depends on what? Depends on the size of the broken part and the surfaces. Next session, I believe I'm going to discuss with you dental materials. And in dental materials, I will explain details, which materials do you use, in which condition. But make it easy so far, as long as it's a baby tooth and a moderate size and one surface only. In this case, we use GIC, not composite. When we should use composite, you need to wait for the next slides. Guys, am I clear so far? Let me check you on the Facebook. Very good, Dr. Shiva. Very good. Yes, please. E, if not GIC, yes. Razor modified for temporary teeth or no longer for razor modified for baby teeth. Yes, we like GIC for baby teeth, okay? Yes. Why? Because the baby teeth can only last for a few years anyway. And GIC has good strength these days, had good color matches as well. And also, it has the best binding to the tooth and has fluoride. That's lots of good things. Lots of good things, GIC. Resin, GIC, resin fiber composite. Yes, GIC, please, GIC. Okay, now guys, look at this scenario. Again, this is Icdas, but in different approach to be easy to you to understand what we're talking about and easy to memorize. What do you think the answer here? Look at this teeth right now. Look at the tooth number 5-1 and tooth number 5-2. See Charlie, right? Easy now. 5 or 6. Why? Because it's extensive caries. Big damage happening in the tooth. Big damage. Because it's a big damage happening in the tooth. So now we're talking about code 5 or 6, which is C, Charlie. In this case, what are you going to do? Are you going to do nothing because the child is 6-year-old and the tooth will come out shortly? Or you're going to remineralize it? Or you're going to restore it with freehand composite? Or you're going to restore it with composite resin strip crown? Or you're going to restore it with zirconia crown? What's your answer here? I see C Charlie, D Delta, D Delta, C Charlie, D Delta, E Echo, A Alpha, D Delta again, Dr. Juicy, Dr. Melzma, A Alpha, Dr. Naveen, C Charlie. I like this confusion happen because once you are confused, it means like we can explain more. And this is giving me indication that we really need to focus in this point then. Not every one of you guys aware about this important points. Because again, in the books has mentioned any one of these can be fine. But when you think clinically, you must have your own clinical judgment on the cases. Patient is 6-year-old, Dr. Anam. This is a patient age. 6-year-old. I mean, like a year, maybe 6 months for a year. The tooth may exfoliate, maybe takes more. So do nothing, which is A alpha, or restore with composite, freehand composite, or restore with composite razor strip crown, or restore with zirconia crown. Which one of these? Okay. Now, do you know what? Everyone has own way, right? You see, Dr. Shiva mentioned confusing options. In the exam will be the same. I believe, guys, you have chosen all the options. You have chosen A and B and C and D and E. Now, let's talk about them. Now, do nothing. Tooth will erupt soon. When do we exactly do this? I tell you when we do it. We do it when there is less than, when there is less than 1 year of exfoliation of the primary tooth, and you ensure 100% that the permanent successor of this tooth will erupt. Two things right now. Actually, make it three things. When you choose A alpha, which scenarios in exam, you should choose A alpha. Or if you get this in OSCE as well. 1, A alpha, the conditions for it. 1, when there is 1 year of exfoliation or less than 1 year. 2, the tooth is loose. 3, when you're 100% sure that the permanent successor on its way, like you have got an X-ray. 5, when it's not in a static reason. Why? Think about it. If you have your own baby, think about it, guys. You have your own lovely girl, like this girl, and you are a dentist, and you have seen this lovely girl with this is broken teeth. Will you be happy to let her stay for a whole year with this broken teeth that may end up to be necrotic because it's alive? The scenario says it's alive. The teeth are alive. And then to be necrotic and result in infection and aesthetically will not be appreciated. That's people, even they can somehow pull her friends or her colleagues in school. In this case, you will end up with psychological trauma to the child. Right? We don't recommend it. Especially after the child come back to you. So now, do you think really A alpha can be a good option? No, I don't recommend it. Personally, as a dentist, I will not. Right? That's one thing. The other thing right now. What about option B? Recommend 1,000 ppm fluoride toothpaste. Completely wrong. Why wrong? Because remineralization will not be good in this option. No mineralization because there is cavitation. What about restore with freehand composite? Will not last there. Why? Because freehand composite, you will not be able to get the proper static, the proper size, the proper shape. It will not last for a long time because the tooth is already once, imagine, once you go in to clean this part, you end up with what? No tooth structure left. So you need to strengthen the tooth. So freehand composite will not be a good option. What about restore with zirconia crown? Too much, very expensive for this age at this stage right now. It can be, but it's just only gonna last for 1 year. And I believe resin strip crown, which is a form, sometimes we call it form crown, right? The strip crown, we call it form crown, will be the best option in this case. Why? Easy to do, direct restoration, strengthen the tooth, make the tooth strong. What I mean by strengthen, make the tooth strong, plus affordable option, not as zirconia. You got all the option, you got all the advantages from this option only, which is D delta. So guys, the answer here is D delta. Restore with composite resin strip crown. I hope now you are aware about the different modalities of treatment based on Icdas and the new Icdas, because this is new approaches. Before we haven't treated this condition that ways. Again, the clinical judgment, which is pedomath. Let's use pedomath approach here. Code 5 or 6, what does it mean? Cavitated, so remineralization will not be possible. Then it's extensive caries. Code 5 and 6 mean extensive. So restoration only not be enough. So in this case, we need crown. What is the best crown for anterior teeth? Composite strip crown. What if it was posterior teeth? And crown is indicated. I may use stainless steel crown, or again, strip crown can be used as well. Now let's discuss about permanent teeth. Let me check if you guys have any question here. Dr. Hash asked question. What's the difference between freehand and the strip crown? Freehand means you're not using any crown. You just get the spatula, sorry, the flat plastic instrument, and just only keep patching the tooth around without using the foam crown, the plastic foam crown. But the strip crown means it's a plastic crown. It's a plastic foam. It has the same shape. It's like a mold for you. It's a small plastic crown. It has the same shape of the tooth. You just fill it with composite after you remove the caries and just put it on the tooth back again and then cure it and then finish it later on after this. Okay, that's called a strip crown, plastic strip crown, which is it's a form. It has the same shape. Sometimes we call it an index, if you want to use the word index for it. A question from Doctor. Guys, let me show you this question, by the way. So it will be, you know exactly what I'm looking at. A question from Dr. Melsma. And doctor, then the tooth exfoliate in 6 months. One very unhappy parent. Why? No, they've been happy because it did good job for a 6 month or a year. Anyway, exfoliation can happen between 7 to 8 year old. It can be even more than a year anyway. Yes, stainless steel crown, metal, stainless steel, zirconia, could be both. Yes. Say I have. Good. Dr. Melsman asked question, what is the price? That's a very good question, by the way. What is the price for, where was the question gone? Yeah, what is the price for composite strip crown in Australia? I would say for a baby, it's normal composite restoration in the child maybe comes as, because you're going to consider at 3 surfaces or 4 surfaces composite restoration, it may end up with, as a normal restoration, direct freehand, maybe up to 350, 400. And then the strip crown will be the same, 400 as well. I believe the same price. Yes, with Dr. Lev, tell me. Dr. Bido, yes, with Dr. Lev, I'm here. I'm not quite sure, Dr. Lev, if you have asked question or not before, but I will check this. Is tooth prep done for a strip crown? Not really a prep. We remove the caries somehow, but not a prep, no. We remove the caries. Dr. Bido, for the previous question, GIC, reason modified GIC, and composite, which should be chosen? Reason modified GIC, because reason modified GIC, because it's static zone, static area. Reason modified GIC will be aesthetically appreciated in this part. So I may go more toward reason modified GIC. What if the tooth is slightly mobile? Still, you can use a crown for it, strip crown. Out of the mouth is in 1 year. Look, if you don't like your baby and you care about the money more than your baby, that's gonna be a choice. But as a dentist, I care about the money as well because I need money. No, I'm just kidding this part, guys. Okay. As a dentist, definitely I care about the child because I don't want the child to suffer in the future. But now, as a parent, it's up to you. What do you choose? The money or the child? Is there any chance here after this treatment, coming tooth will be carious? That is unlikely to happen. No. Why? Why the coming tooth will be carious? No. Look, everything possible in this life, it can be, but unlikely to happen. If we talk about children in regions without fluoride in water, we prefer toothpaste with high ppm or mouthwash. Toothpaste. No problem, Dr. Hash. Dr. Muhammad, if the child cannot provide the cost of treatment, will it choose C? I can't remember what was C there. Maybe Dr. Muhammad, but maybe what is C? Let me check what was C. See, restore is free-handed. No, but still, free-handed gonna be the same price with the resist with the strip. Strip crown not expensive because I believe mostly will be the same price. Okay, let guys back again to the slides, please, and then I will answer question later on, or actually like time by time. Okay. The slides. Let me share the slides back again to talk about permanent teeth now. Permanent teeth. Let's start Icdas for permanent teeth in clinical way. Looking at this photo right now, do you think this lady or this young girl, which is 19-year-old, is she's going to be which one of these? Visually, I'm talking about visually only, by visual. Which code? A, right? No problem, Dr. Liv at all. No problem, Dr. Liv. It's my pleasure, Dr. Liv. A alpha, Dr. Sangita, right? I agree. It's 1 to 2. 1 or 2. A alpha. Why? Because enamel not broken. It's just only deep fissures. That's it. It's A. Right? Okay. And I'm already not that much broken. I would say it's still A alpha. So what is the management? A alpha. What's the management, guys? Is it to apply fissure sealants? A alpha. Apply fissure sealants. B, place preventive resin restoration. C, monitor and review in 6 months. Take bite wing x-rays. Apply topical fluoride vanish. Which one of these? Do you know what is the right answer? D delta, guys. Imagine. Hello. Why A, guys? Why A? Write down this. No x-ray. No fissure sealant. Guys, write down this Bidu math. No x-ray. No fissure sealant. Easy. Okay, big surprise. Okay. Dr. Daniel mentioned I felt it's D. Thank you, Dr. Melsma. Yes, we need X-ray to confirm cavitation first. Okay, guys, so what's the answer here right now? D delta. No X-ray, no Fisher sealant. So A alpha is not right before D. D first and then A alpha. So now D first, then A alpha. So the answer is D delta. The bite-wing radiograph showing no caries extending into dentin. That is nice poetry. No caries extending into dentin, right? What is the most appropriate next step in management? Easy now, right? The answer is A or B or C or D or E. Okay. Look, guys, there's perfect. I love this. You know, when I see you guys somehow have some confusion at this point, right? It means like you really think. And I love your thinking way. Let me share this, guys, to you. I love to see this part of things. Let me just get it to you right now. Let me share it. Look, guys, this question. This question is a very good question. The question is, Dr. Gilan asking very good question. Doctor, it was written events that in code 1 or 2, we do topical fluoride, right? I agree. But look at the question here first. Let me get the question back again. Let me share the screen again to the question. Please, guys, pay attention to every single word. Please, guys. The question there have asked you about, look at this word, visual. Only visually. Only visually. What do you think visually? It's 1 or 2. Did you check with X-ray? No. I see there's needs for X-ray. I cannot rely only visually. Sorry. I cannot rely only on visually. We need X-rays. Guys, can you do restoration? Or can you decide only visually on occlusal caries? Can you decide on occlusal caries or interproximal caries only visually? No. So now, the question here has mentioned that visually, I believe 1 or 2, but still, is the ICDAS now complete? No. ICDAS hasn't completed yet. You need to take an X-ray to confirm 1 and 2 based on ICDAS. Now, if you find it completely 1, 2, now remineralize it. But what are you going with these deep fissures? Are you going to remineralize it only? The answer is no. I hope now, guys, clear. And by the way, that was really very good question. The answer is apply resin fissure sealant. Why resin fissure sealant? Because we like resin more than GIC, fissure sealant. Now, guys, would you like to have session tomorrow, by the way? I will post after this class if you want. If you want to have session tomorrow, I may post of this class, and then if I found up to there is at least 100 champions, because I know it's a short notice, definitely. So I know you may have plans tomorrow, but if I have about 100 champions, they go into, and again, by the way, as a private link, new link, guys, okay? Because I don't want to disturb the rest. I believe even one will be on the Facebook too. So if you really guys like it, I will leave a post in this case. You can comment in it. If I found less than 100 means I should keep this session any other time when everyone is available, okay? Okay. Now, what is the answer for this question? There's another question here. We see patient first time, no cavity indenting, remineralization and follow-up. This is not for occlusal, not for occlusal. Occlusal, if you have any deep fissure, as it was shown on the photograph, you really need to do either fissure sealant or restoration. With deep, okay, guys, make it now Bido bytes. Okay, sorry, Bido math. Deep fissures equal to fissure sealant straight away. That's it. To be easy, okay? Now, we're talking about tooth number, this tooth. Let me guys see if I'm sharing the right. Yeah, I'm sharing the right thing, yes. The slides, yes. I'm sharing the slides, yes. Now, we're talking about which tooth right now? We're talking about the tooth number 24, like this one. This caries. What do you think? How big is this caries? This tooth. How big is this caries? Is it into enamel or into dentin? Which one of these? I believe it's only into the enamel. Is it more than one half? You know what? Let's make it big. Maybe guys, you cannot see it properly. What do you think right now? This is an anterior enamel junction. And this is a caries until here only. Like all of this. Now, is it endodentin? The answer is no. Is it one half of enamel? It's more than one half. So now, if it's more than one half, what should be the coding system? Answer is code 2. Okay. In code 2, are you going to remineralize? Yes. We're going to remineralize. Right? So let's get now. It's code 2, by the way, guys. Okay. Now, what is the most appropriate management? Is it A or B or C or D or E? Is it A or B? We need to remineralize, right? Or C or D or E? Let's check your answers. Your answers, B Bravo, which is a recommendation. I see here B Bravo from Dr. Golmerza, D Delta Dr. Natali, D Delta Dr. Dempo, B Bravo Dr. Tanvir, D Delta Dr. Gilan. That's the first time Dr. Leo not going with B Bravo Dr. Leo, D Delta Dr. Leo, B Bravo Dr. Anita, Dr. Gagan Deep, D Delta, Dr. Hash 2, Dr. Ejika D, Dr. Taslim D which is apply fluoride vantage, okay. B Bravo, after our logic, best is B. You're very close, by the way. You're very close, Dr. Daniel. Dr. Melsma, D Delta, Dr. Shriyanka, B Bravo, Dr. Lakshmi, B Bravo, D Delta, B and D, B and D, B, 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 B. A big surprise. No one of you has provided the right answer so far. Answer is A. You see, guys, this is a problem. Imagine learning something new, right? A big surprise. Guys, can you tell me why do you think A alpha is the right answer here? You know what? I make it easy for you. Everyone, there's some of you crying right now, right? Guys, don't cry. That's okay. This is about EDC exam. That's EDC exam. Can you see the screen? Let me just share the screen again. Sorry. That's a screen. What is the most appropriate management? You are in shock, right? Okay. I will ask you very simple, easy questions. To understand this concept, you need to answer this question. Every one of you should answer this question. Okay? Why did you choose? Everyone had chosen B Bravo. Why did you choose B Bravo? If you answer this, if everyone going to answer this, you will understand why A alpha is the right answer. What was your objective to choose B Bravo? What are you aim to? What did you aim to when you choose B Bravo? What you be looking for when you choose B Bravo? Quickly, guys, everyone has answered B Bravo. Very good, Dr. Gagandi. Pre-mineralization. I love it. Keep this word with you. Thank you, Dr. Shashank. Remineralization. Very good. Thank you, Dr. Daniel. Remineralization. Easy now, guys. Be bravo for remineralization. I'm happy. Everyone has chosen D delta. Everyone has chosen D delta. Why did you choose D delta? What was the aim behind D delta? What was in your mind when you choosing D delta? Dr. Anum mentioned remineralization. I'm happy. Let's wait for another people choosing D delta. I need to know what is the objective. What was the aim for D delta? Why did you choose D delta? Guys, if you don't answer this question, if you're choosing D delta and you don't answer why did you choose D delta, you will not understand why is right answer. Very good, Dr. Dempo. Remineralization, D delta remineralization. Dr. Gilan, remineralization, again deep. Okay, I now will make you both happy. If you're choosing B Bravo, it's correct because you aim for remineralization. If you're choosing D Delta, you are correct because you aim for remineralization. Do you know that? Look at this, very tricky here. Do you know that tooth surface modification means what? Means remineralization. What does it mean? Tooth surface modifications equal to remineralization. So you may need to use B and you may need to use D together. Not only B, not only D, you need B and D together. That's why. Guys, did you know from before, or do you know from before that tooth surface modification means remineralization? Do you know this from before? Guys, do you have TG in your hand right now? Do you have TG, guys, in your hand? Can you please open the caries chapter? Quickly, open care chapter. In management of dental caries, what is the first thing ever in management of dental caries? Can you please, guys, write down TG and then write down what's mentioned there? If you have seen this, write down TG and then write down what's written TG in this part. Yes, open and tell me. TG, yes. Mention, please, guys, what is in this part. There is something called tooth surface modification in TG or not? No? How come TG doesn't have? Dr. Naveen, I think you read different TG than the one we had then. Page 65, Dr. Hatch, there is nothing called tooth surface modification TG? Are you sure 100%? Seems like guys are using different TG then. Someone has mentioned something. Tooth surface modification using okay, very good. So it's mentioned there, tooth surface modification. Can you please, guys, tell me what is tooth surface modification there means? Using remineralizing agent, placing facial sealant, this stuff. So it's more toward what? Remineralize the tooth back again. Guys, did you get it right now? Did you get why, guys, A alpha is the right answer here? Because tooth surface modification is the how would say remineralization as a part of a management in this part. It's a general term which include both together. Guys, I'm happy you got this concept right now. Imagine this is the way happen exam. exactly that way. You have the knowledge, you have the information, but just only need to be able to understand the overall ideas about the management in every single topic. This is the right way you think. That's why, right, you should see dentistry in this perspective, from this vision only, not just reading and study. It's more like when you go to exam, look at the question exam, you be careful from every single word. As I always say, read the question word to word, word to word. Okay, good. I'm happy, guys, you got this idea. So now, as appropriate management, we need to do two surface modification. It can be in form of, it can be the form of 500 ppm fluoride toothpaste. It can be in a form of topical fluoride vanish. It can be a form of clean. A clean as well will help in remineralization. Like it could be a gel, foam. You can use even a floss between the teeth. Answer is A alpha, two surface modification. Now, Bido math. Back again to Bido math. Clinical judgment, Bido math. Diagnosis in this case was code 1 or 2 or 3, which is initial caries. So if it's code 1 or 2 or 3, which is initial caries, in this case, the treatment, it can be two surface modification or management. Call it treatment, call it management, but it's more into management, okay, rather than treatment. Two surface modification, which is remineralization, okay? Remineralization, two steps, home care and dental clinic, same exact like before. Or hygiene and fluoride. We need to use both in at home care. Or hygiene, same like before. We discussed this before. Fluoride, same like before. But here in toothpaste, there is different information, a little bit different information. Toothpaste for older than 6-year-old, not elevated risk. Just use 1000 to 1500 ppm if the child 6 or to adolescent. If adolescent to adult, you can use the same as well, like same toothpaste, which is, we call it as adult toothpaste in this case, and then twice a day. What if it's elevated risk, like high risk? Child 6-year-old to adolescent, in this case, use 1000 to 1500, but more frequent. What if it's adult, like 12-year-old, 16-year-old, 18-year-old? In this case, you can use the same toothpaste, which is adult toothpaste, more frequent, or to use the therapeutic toothpaste, that's guide therapeutic. Therapeutic toothpaste, which is 5000 ppm fluoride. Mouth rinse is the same things we discussed before. At dental clinic, same things we discussed before. Now, clinical case 6. Look at this x-ray. What do you think is the diagnosis for tooth number 36? This is tooth number 36. I will make it, guys, this one. Which code? I think it's enough now. You have seen it now nicely. So which code? Code 4, right? I agree. Perfect. What is the age of adolescent, Dr. Tanvir? Adolescents, actually, we have early adolescents and we have middle adolescents and then late adolescents. Early adolescents, I would say, start from 10 years and above. And then midway or middle adolescents, I would say it's about 14-year-old. Late, it's 16 and above. 4, right? I'm very happy. Code 4. By the way, guys, if you don't know about coding system or how to identify this, please go back again to my previous lectures. Dr. Sarel asked question, Dr. Read on treatment plan for C2. It has mentioned that the treatment is normal home care. Yes, Dr. Sarel, if you're 100% sure, it is 2. Yes, if it's 100% sure, it's 2 visually and by X-ray, not only visually, okay? Visually and X-ray, yes. And home care to do what? Home care to do what? Home care to get the 2 steps modification, which is remineralization. Now, answer, guys, for this is code 4. Now, what do you think is the management for code 4, guys? Are you going to restore it? What are you going to do with this tooth? Are you going to restore it or are you going to remineralize it? Which is tooth surface modification. Let me check your answer. No problem, Dr. Sarah at all. Guys, is that restoration or remineralization? Which one? Restore, restore, restore. Restore. That is, guys, your answer. Let me just get this one for you. I see mentioned restore, restore. Dr. Fatima, restore. Dr. Roy, restore. Dr. Nate, restore, restore, restore. For restore, for restore, for restore, 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 restore. Thank you very much, guys. Now I'm happy. Everyone liked Dr. Shashank comments. I give her heart. Treatment of code 4 depends on the risk level, right? Depends on many things, not just only the risk, but what of them the risk. At least you mentioned something differently. I'm very happy and proud of this. So, in no necessity to be restored, it can be remineralized. Not every, guys, not every code 4 must be restored. Interproximally, we're talking about interproximally. We're talking about X-ray. When you see interproximal, code 4, interproximal. Not occlusal. I'm not talking about occlusal. I'm talking about interproximally on X-ray. Right? In this case, you don't need to restore all the time. You may need to remineralize. No cavity, no restoration. Thank you, Dr. Eshika. Restore if cavitated. Thank you, Dr. Valija. Depends on cavitation. That's correct, Dr. Amrain. Code for no cavitation, no restoration. Very good. Dr. DD damage, restore. Not. All the time. If no cavitation, no restoration. Thank you very much. There are many cavities on other tooth. So now, the answer will keep it for you because I will not provide answer for this question. It's just general question. So do we really need to restore every code 4? The answer is no. Code 4, it can be restored, it can be remineralized. Based on what? Based on this. Based on this. Please, guys, pay attention to this slide. C for lesion management. If low to medium risk, look, if it's elevated risk, restore straight away. And we discussed the elevated risk last session, if you remember, or the previous one of the previous sessions. If it's elevated risk, restore straight away. I will not explain again when you should say elevated, when you should say low medium, because I discussed this in the previous sessions, if you remember. Now, if it's elevated risk, straight away restore. But if it's a low medium risk, now we have different options. When to restore? When the resolution is more than or equal to 1/3 of dentin. If you look here right now, you may say it is equal to 1/3. If you consider, like, it's up to you. I'm not taking decision here, by the way. I'm not telling you it is restore, not restore. We discuss the options, right? If it's more than 1/3, in this case, you may need to restore. If it's cavitated after separation, how do you know if it's cavitated or not separate? How to separate? Use wedge maybe, flat plastic instrument, gently. You may use rubber separator, the one we use it for orthodontics, to separate between the two teeth so you can see what is there, if it's cavitated or not. Now, if it's a low or medium risk and the resolution extends more than 1/3 of dentin, restore. If you separate it and you find cavitated, restore. But if not cavitated, don't restore. If it's arrested, don't restore. Guys, am I guys clear about this right now? Guys, is that guys clear so far? Very good. Okay, guys, I believe at this stage, things actually Dr. Bido, what's the difference between cavitation and frank cavitation? Frank cavitation, you can see it easily by your eyes. You don't need separation, you don't need anything correct. But cavitation, frank cavitation, it's big enough to see it. But cavitation can be any cavitation, can be small one. You can see it or you cannot see it. You may need to separate to see it. It can be hidden. That's why frank means clear, easy to see. Okay? Okay. Okay, guys, I believe at this stage right now, we done Icdas in completely different ways. Look, you don't need to mug it up the things right now because I didn't discuss mouth rinses differently, and then discussed about home care differently, but I discuss it as clinically based, as a way that you're going to get the scenario in exam, as the way you're going to get the case in your clinic. Okay? Okay, guys, thank you, Dr. Pawandi, very much. Tomorrow we may have session if I find more than 100 candidates reply or interested, reply the post. I will post it right now. In this case, guys, we're going to have session tomorrow, but if you get less than 100, means, guys, you're not available for tomorrow, so we can do another time. Thank you, Dr. Pawandi, very much. Doctor, can you please explain more about tooth separation? Tooth separation, how to do? So you can use it, you can do it immediately by using a gentle way like a wedge after you anesthetize a patient. Otherwise, you may get trauma. So try to be gentle when you do it. And then you can do it with flat plastic instrument gently, but the best way and the most careful, gentle way is to use orthodontic wrapper separator, right? And this is going to be separate the tooth after a few days. This is the one I recommend, by the way. Because the other ways actually could be a little bit more traumatic, the tooth, which it's not recommended. Thank you, Dr. Leo, very much. Dr. Melsma, how do one confirm arrested or not in such case? Dr. Melsma, I discussed this question in the previous session. Please, if you can, because it's a little bit lengthy. So please, if you can check this, please. You know what? Easy way, you will not find this is it's indirect, this one, but apart from the color and the texture and all that stuff, you may not see that the gum at this area is inflamed. If the gums in this area, which is interdentally not inflamed, that somehow can be an indication that the case is arrested, but still we need to check the color, need to check the texture and all this stuff too. Thank you, Dr. Dipali, very much, Dr. Dipali. Dr. Hani, doctor, sorry to bother you. You never bother me, doctor. But if it's possible, can we briefly discuss elevated and low moderate? Okay, now it's long one. That's gonna be a big one then. Look, it was mainly about if it's a new patient, so may have one lesion, a new lesion. Okay, may have white lesions if it's a new patient. And then the patient may have saliva issue like dry mouth, because that is one of the things as well. And then the patient, this is what we said, the red, if you remember last time, I have made the risk factors into three main risk factors. We give the first one red flags, red color, and the second risk factors was actually in orange color, so we give them the orange color. And then we have the tooth protective, which is green color. So the red color, if you have one of them, it will be high risk, any one of them, one which is a white lesions. And then we mentioned as well, that is white lesion or a new, let's say a lesion, like Kerres lesion. And then we said if the patient has hyposalivation, so that's going to be in one of these. And then the orange risk, we said, for example, patient has bad oral hygiene, has a little bit of plaque, the patient or forever. All this stuff you remember. It should be have combination of each of any of the stuff. And then the protective, which is fluoride, which is a good oral hygiene. If you miss any one of this, is what can be low or it can be high as well. Please go back again to lecture, please, doctor. Thank you, Dr. The previous lecture. Thank you very much, Dr. Gagandib. Thank you very much, Dr. Natali. Thank you, Dr. Very much, Dr. Shashank. Thank you, Dr. Very much, Dr. Niga, Dr. Shiva, Dr. Anita, Dr. Gilan. Thank you very much, Dr. Sarisha. Thank you very much, Dr. Eshika. Doctor, if the patient has more mouth, has more, or what is more mouth? That's not a patient, then that's as Dracula then. More than one mouth, a sore mouth. Can brush and less than 6 years. Then what should we prescribe? Too smooth in this case. Too smooth, I would say. It sometimes we do this way, but I don't want to say it. But sometimes advise the parents to get like a gauze or a cotton with a fluoride mouth rinse, and then to just, and also we can also do varnish as well. Varnish is good as well. You can put varnish with as a varnish plus TC sorry too smooth, or I sometimes advise a patient to get like a cotton and then just dip in it and mouth rinse and then just to wipe the teeth. Thank you, Dr. Anjali, very much. Thank you, Dr. Fatima. Thank you so much, Doctor. This was great session. Changed the way of thinking. Yes, please, Dr. Fatima. I'm very happy to hear this. Dr. Kelvinda, thank you, Dr. Bill. Thank you, Dr. Kelvinda, very much. Dr. Melzim, Dr. Adam, how to confirm a retinal interproximal? I think I have answered this one, Dr. Melzim, right? Dr. Bidu, thank you very much for Simran. Cavity with arrested caries will need restoration? No. If it's not static, no. If it's static and maybe dark color, like a because normally dark, you may need. But if it's not a static reason, just keep it. Thank you, Dr. Vanika, very much. No problem, Dr. Melzima. Thank you, Dr. Shayanka, very much. Thank you, Dr. Dempo. Thank you, Dr. Sanjita, very much. Was a challenging session? I agree on this, Dr. Sangeeta. Thank you, Dr. Asanka. Thank you very much. Dr. Anita, what time will be the session tomorrow? Most probably, if you guys happy with it, I will post it right now and everyone will be available. So it will be tomorrow at 7:30, I would say. No problem, Dr. Didi Damage. No problem at all, Dr. Didi Damage. Dr. Rahit, Dr. Bido, thank you. One question. What is the best way to confirm secondary decay in class 5 feeling for anterior teeth? The best is the patient will have a complaint somehow. This is the first thing. Second thing is to get secondary caries means you really have, this is very good question by the way, Dr. Red, very good question. The patient will have, because secondary caries means there must be leakage has happened. There is difference between the word secondary caries and residual caries. Residual caries means the dentist didn't remove all the caries, so it's residual, it is there. Secondary caries means there was no caries after you cleaned, there was no caries. So why the caries has happened? Definitely there is a micro leakage has happened for saliva between tooth structure and the composite. And it is gonna happen. You're always gonna see staining around the tooth restoration junction will be staining. At this area, you'll find it a little bit dark staining and shadow around it, and maybe a little bit of whitish discoloration too. I hope it's clear. Can it be visible by X-ray? I would say yes, sometimes, yes. Dr. Daniel, oh, yes, yes, yes. Red, orange, green. Very good. You remember it, right? I'm happy now, Dr. Daniel. Thank you. Yes, this is what we discussed in last session, if you remember. Thank you, Dr. Rubido. Have a good night. Thank you, Dr. Amolia. Dr. Daniel, oh my God, yes, how can I forget this? That's okay. We are human. We forget things. That's okay. Then you remember then next time. Dr. Daniel, thank you so much, Doctor, for truly very, again, fruitful session. I love this word from you. Have a great night. Thank you, Dr. Daniel, very much. Dr. Lev, thank you for your lecture. Hope with this education we will succeed exams. Best wishes to everyone. Thank you very much, Doctor. Believe me, I have no doubt that guys are gonna pass the exam. And doesn't mean you struggle once because for any reason. I'm not saying because you take a course or not course or the stuff. I will not go this way. But exam is doable. As you see, things very clear. Even can be mentioned TG, as I'm referring right now to TG. Or it can be mentioned in Icdas. You can even read it. You will read it once you go in Icdas part. But the only thing is exam somehow a little bit tricky in words and the way they represent the questions. So that's why most probably when you think more clinically based, you will see that you can get the right answer. And that's what I'm trying to convey to every one of you guys. Dr. Melzma, thank you, Doctor. Fantastic session. Learned a lot. Thank you, Dr. Melzma. It's my pleasure, guys, to see all of you. It's my pleasure always to see you happy, guys, and see all of you here, guys, going through all the things together. Thank you, Dr. Haj, very much, Dr. Haj. Thank you, Dr. Ala. Thank you, Dr. Bidu, for your patience. No problem, Dr. Sarato. It's my pleasure always. Dr. Daniel, I'm so excited to integrate this in the clinic. I am so excited to apply Icdas. You see, that's my happiness, my pleasure, my gladness. When I see you guys using this information, not just only for the exam, this type of information gonna make you a better version of a better dentist, a better version of yourself. As we always guys grow. I grow in every day. You grow too in every day. Dr. Anam? Okay. Dr. Anam, thank you so much, Dr. Bido. I it was so wonderful taking your class, although I didn't able to take initial 30 minutes of your class due to my job. I'm very sorry, doctor, for this. But anyway, I think Facebook will keep this session. I hope so. But I really wish it gets saved on your Facebook page. I hope so. So I can copy. I believe so. I don't delete on any of the sessions intentionally, but I don't know why for some reason Facebook do. Moreover, you are one of the best teachers in my whole journey who made the dentistry so easy and interesting. Thank you very much, doctor, for saying this. Wow, you made my day. Like I really started enjoying studying dentistry more than ever before. Thank you very much, doctor, for saying this. You really made, honestly, you are my motivation. Even if I feel tired right now, I may not go to do anything except only looking for some references, looking for study materials to do it for you guys. Thank you very much for saying this. I really started enjoying studying dentistry more than ever before. I'm not sure whether I'm gonna ace the exam or not, but you literally doing your job the best way possible for everyone over here. Thank you very much for this, doctor. And believe me, you will pass the exam. You will pass the exam because this is my belief in all the candidates. I have seen lots of candidates in different ways. I have seen lots of candidates in from the start to the end. They are not similar. I haven't seen candidates similar. Everyone, they have different circumstances. They went through the journey differently. But at the end, everyone passed the exam at the end. Thank you very much, Dr. Anum. It's my pleasure. Thanks very much again. Thank you, Dr. Ishika, very much. Thank you, Dr. Shashank, Dr. Tasneem, Dr. Monisha, and Dr. Rohit, and Dr. Sarah, and everyone of you guys. Thank you very much, guys. I will post for tomorrow's session if you are interested to take it. I will do it. If not available, that's okay. We can do it any other time. Thank you very much, you guys. Have a great night, everyone. Thank you very much. Bye-bye.